Hey everyone, welcome to our program this evening. We're going to start in just a moment. Thanks for joining us. Stay tuned. All right, everyone, give us just 1 minute. We are working on some tech behind the scenes and we'll start up in just a moment. Thanks for being here with us tonight. All right, everyone, we are going to go ahead and kick off. Welcome to the Arlington Committee of 100. Our program for this evening is How Are Virginia and Arlington Addressing Our Crisis in Mental Health Care? My name is Hannah Dannenfelser. I'm the chair of the Arlington Committee of 100, and I'm going to be your moderator for this evening. If you're watching us on Facebook Live and you think this is something your friends would like to hear, please consider sharing that Facebook Live to your page. And to stay in touch with us, please consider liking and following our Facebook page. We publish our events through email announcements as well as the Facebook events, and we'd love to have you continue to join us. As we get started, I want to go ahead and welcome a few of our elected officials who we've spotted who are joining us today. For one, Sheriff Beth Arthur, who is one of our panelists. Want to acknowledge her. Delegate Patrick Hope, who sits on our board of the Arlington Committee of 100 and is our program committee co-chair, who helped lead up coordinating this program for the evening. County Board Member Matt DiFerrante and School Board Vice Chair Reed Goldstein. If we have any elected officials who I missed, please would welcome that you shoot us a little note in the chat. We'd like to thank you for being here. We pull off at the registration list, so if you just came in, it's possible we missed you. So Beth, Patrick, Matt, Reed, thanks so much for being here. Glad to have you. Before we start our program, I want to share some Committee of 100 announcements, in particular on behalf of the Committee of 100's nominating committee. For the next week, we're going to be accepting applications for the 2022 to 2023 Board of Directors. The Arlington Committee of 100 fosters open and vigorous discussion of issues involving all facets of community life in Arlington. Our monthly forums, as you know, I hope by now, are open to all, and these are meant to be a nonpartisan setting where issues of local, regional, and state interests are addressed by experts and have great audience participation. It's one of our favorite parts. So if you would like to be part of our board, we would love to have you. We are an all-volunteer organization, which means our board leads the mission, the vision, and the execution of our organization. And in particular, we're looking for board members with many skills. In particular, we would welcome marketing experience and event organizing experience. Our board is a really highly engaged group of community leaders from numerous areas of the local community. And they're passionate about us being a nonpartisan platform for education on timely local issues. If you take a look at the screen, I'll refrain from reading it, but if you take a look at the screen, we have a couple of the kind of some of what the expectations are as a board member. Please stay tuned. We'll be sending an email out to our list soon that this will be referenced. Please check your chat box right now in the Zoom because the link to the application is in the chat box of the Zoom right now. Please make sure to apply by Saturday, May 22nd. And our nominating committee will review applications. So really hope to get some, we'd really love to welcome some new folks to our board next year. Also want to ask you to please go ahead and mark your calendars for our next program on Wednesday, June 22nd. the future of historic preservation in Arlington. I do want to highlight this is a different date than our regular cadence. We usually do the second Wednesdays of the month, but next month it's actually going to be on the fourth Wednesday. I appreciate Scott helped me out with that. I was saying the third Wednesday. I did my math wrong because the first of the month is a Wednesday. So fourth Wednesday of June. In the past, our last program of the year, often, not exclusively, but often has been some way reflective of history and looking back. So this is going to be a really nice way to wrap up our program year. As our regulars know, we do take a break for the summer, and then we come back in the fall, and we'll be excited to welcome you back at that point, but it's not goodbye yet. We've still got some time. The program next month is also going to serve as our annual meeting where we're going to announce the slate for our board, which includes our officers as well as our new board, our intended officers and our intended new board members. And then we'll be asking you to vote on that slate during the meeting. Please stay tuned for those announcements. So, and tonight, I'm going to go ahead and get to why you are really here tonight. Thank you for bearing with me with some of those announcements. We are here to talk about what's being done to address the severe shortage of mental health care services in our area. We know this is very much a national issue. We know this is very much a state issue, and it is touching us significantly in Arlington as well. Our panelists who are joining us are representing the state and local. Really excited about who we have tonight, because this is going to be, I think we've got some really critical and crucial information for members of our community. Our panelists are Sheriff Beth Arthur, Nelson Smith. So Commissioner Smith, he's the commissioner of the Virginia Department of Behavioral Health and Developmental Services. So he'll be speaking from the state. And Deborah Warren, who is a deputy director of the Arlington Department of Human Services. And I'm sorry, we actually didn't listen here. And Deborah, feel free to correct me when we get to you, but executive director of the CSB as well. I might have tweaked your title a little bit there, but I think I got it right. The executive director of the Community Services Board for Arlington as well. So we're really glad to have them. A special thank you to Patrick, Delegate Patrick Hope, and Jeannie Broyhill, who teamed up to coordinate the program tonight. We really wanted to take this opportunity to broaden our lens from not just something that touches Arlington, but really something that the issues you'll hear tonight are going to be affecting our partners in Fairfax, Loudoun, Richmond, Chester, all of the places around Virginia. So I think this is going to be a really great program with some important information. We will have, as always, we're going to have a Q&A with the audience following the program. Please use that Q&A chat box. I want to remind our audience that we only select questions that are asked in the form of a question. We're looking to generate informative discussion with our panelists, so we do not take statements and we don't take rhetorical questions. I definitely encourage you to keep your questions concise and to the point. It just makes it easier as we're screening through the questions to be able to highlight those to the top. We do have a high volume of questions. We get to as many as we can at the end of the evening. We always have many more that we wish we could get to, but we don't get to. So we'll get to as many as possible this evening. All right, you have heard enough from me. I'm going to go ahead and kick it off to our panelists here, starting with Commissioner Smith. Again, Nelson Smith is the commissioner of the Virginia Department of Behavioral Health and Developmental Services. He has been appointed by Governor Youngkin to lead the state's Department of Behavioral Health and Mental Health Services, and he actually recently unveiled the department's first strategic plan in the last 8 years. His background, he's been a CEO at several hospitals. He's been in the U.S. Army Special Forces as a combat dive team leader, and he more recently was overseeing the Tucker Pavilion over at the Chippenham Hospital. So in particular, his department that he's leading up oversees the state's 8 publicly funded mental health hospitals. So he'll be speaking to us about the statewide bed crisis and the agency's plans to address it. Commissioner Smith, I will pass it off to you. Thank you again for being with us tonight.
Thank you very much, Hannah. All right, let me try to share my screen.
Do you have the button for share the screen?
Yeah, just forgive me.
Perfect.
It took me to this Apple.
Oh,
I have to allow it. So forgive me. I didn't do this.
no worries.
It's going to be a minute. you can, if you'd like to try to move on, you might.
Would you prefer, would it, should we maybe perhaps go to Deborah? And then I know we wanted to keep with the order, but would you like if we go to Deborah and then we can come back to you? Would that
Yeah,
make
sorry,
more
it's the
sense?
security settings on this. I had to switch laptops at the last
Oh,
minute.
no worries at all. No, absolutely. We are happy to be flexible.
Great.
Deborah, can we go ahead and pass it off to you? Is that all right? And I can introduce you? Does that work for you,
Sure.
Deborah? Okay, perfect. All right, we will get right back to Commissioner Smith. Deborah is as I said, she's the Deputy Director of the Arlington Department of Human Services and serves as the Executive Director of the Community Services Board. So Deborah oversees behavioral health, children and families, Aging and Disability Services Division, and in her current capacity, she also leads the county's child care initiative and serves as the chair of the community management and policy team. She has a really significant career, has worked in this for quite a while, but she just joined the Arlington team back in 2017. And she was in Alexandria City for a long time prior to that, working in this field. So a lot of experience. And Deborah, we're really grateful to have you here. I will go ahead and kick it off to you.
Thank you very much. I have a PowerPoint, but I don't know if you can see it. Can you see it?
Can't see it quite yet. If you press that share screen button at the bottom.
I did, but
Oh, you did?
try it again. How about that?
This is looking progress. Yep, there it is. Perfect.
All right. Welcome,
All right, all
everybody.
yours.
I'm so glad to be here this evening. Thank you for having me. I am responsible for the Arlington Community Services Board. And for those of you who don't know what it is, very briefly, the Community Services Board is a very comprehensive web of services that provides really targeted behavioral health and developmental disability services. Our priority populations are persons with serious and persistent mental illness, substance use disorders, and developmental disabilities. And our population is primarily, the most vulnerable. We are the safety net that serves, the most poor really in Arlington. I'm here to talk about our crisis services, what we're doing now, just very briefly. We have our emergency services that you may be aware of, where we have 24/7, 365 staff providing assessment, intervention, and crisis stabilization when there is a behavioral health emergency in the community. Our staff are called by all kinds of folks, family members, police, the hospital, EMS. And we've done a few things in the last couple of years to strengthen these services. One is that we've embedded a clinician at our emergency call center because calls come into 911 and a large proportion of those calls are behavioral health calls. So the clinician can consult with our ECC partners, can actually talk to the individual on the phone, de-escalate the crisis, and if needed, can actually go out from the ECC and meet police if needed, and go out to do an assessment. We also have, we call it Diversion First. It's a clinician who focuses on youth and young adults. And this is something that the community strongly advocated for when we were working collaboratively with the Virginia Hospital Center on a site plan agreement, more on the Virginia Hospital Center later. So I think that is a really critical position because we're seeing more and more youth and young adults come into emergency services. Just in the last 2 weeks, we've had children as young as 12 come in. One needed a psychiatric bed and ended up in the emergency department for a whole week. So this is not a good situation. We're very concerned about it and working to try to find alternatives. Our calls pre-pandemic, post-pandemic more than doubled to 30,000 calls. And the acuity of the individuals that we're seeing are very, very, very high, very significant suicidation, triple the number of suicides in Arlington. We're also seeing triple the number of overdoses, both fatal and non-fatal, unfortunately, despite significant efforts in that direction. We're using a mandatory outpatient treatment as an alternative, and that has been successful. So we're growing our use of that. What I want to talk about today that we're doing, that we're working towards to address the state hospital bed crisis, is we have, and we invite Commissioner Smith to come visit us, we have a crisis intervention center that has 5 calming rooms. And this center is underutilized because we have not staffed it. Typically, we would have an emergency services staff just kind of cover whoever was in the crisis intervention center. But due to staffing shortages, and at one point we got down to a 50% vacancy in our emergency services, which turned into a huge crisis. We did address that with retention and hiring bonuses, thanks to the county board. But we recognize that at this juncture, we need to have dedicated staff 24/7, 365 in our crisis intervention center. This would allow us to provide 23-hour crisis stabilization. We are licensed by the Department of Behavioral Health and Developmental Services. We're probably going to need to ask for a waiver for like maybe up to 3 days because it's so difficult to find beds for individuals. We have peer support. That's an individual with lived experience who is very successful in engaging individuals in crisis who may not always want the services that they desperately need. So that's a really important service. This crisis intervention center is available to individuals of any age. So what are we working towards? We are blessed to have the county board support. Last year, for fiscal year 22 that we're in, the county board funded 4 new positions at more than $500,000. We have filled one of those positions because there's such a critical workforce shortage, but we are full court pressing on those additional positions. And we have been allocated $1.7 million in additional funding through the county board of ARPA funding. Now this funding is going to be good for, I think, through FY24. Or maybe it's FY26, but in any event, we have a runway so that we can see if this is the right staffing level that we need, and to identify alternative sources of funding, grants, and so on. We are going to hire a crisis intervention center manager. We are recruiting for that right now. And another piece of this is when we just spent some time today with Dr. Reed Smith, who's the medical director of EMS, working through how we can do medical clearance at the CIC. So our whole goal here is to divert individuals from going to the emergency department at the Virginia Hospital Center, where they languish, unfortunately, for days on end, not getting the care that they need, while our staff are bed searching. The other piece of this whole project is came to us from the police, who are incredibly overburdened. They are spending millions of dollars in overtime, and an entire shift of patrol officers could be at the emergency department, providing one-on-one custody for individuals under a temporary detention order. So what we are doing is working on a contract. We found a vendor who can provide us with special conservators of the peace. And what that is those are security staff who would receive special training in behavioral health, and who would be appointed by a judge and approved by the chief of police to accept custody of individuals under emergency custody order or a temporary detention order. So what that means is that the police would be able to hand over an individual in crisis to the SCOPs, we're calling them, and these SCOPs would be housed at the Crisis Intervention Center. So we would have 2 on duty at all times. The cost of this is very expensive. It's $1 million annually. But we have identified funding for that. And so this is all really building like a crisis receiving center from the ground up. We're at the point now where it's really finding the individuals to staff this. And I'm praying that we can do that and get this really up and running for fiscal year 23, certainly by the fall. So that is one big change that Arlington has been working on to address the state hospital crisis. We have been simultaneously working on a number of other fronts. And one of the pieces of our Marcus Alert, the Marcus Alert legislation, is to have a voluntary health profile available so that law enforcement and others can access this information. So say, for example, I had a daughter with—
Deborah, I'm going to give you a 1-minute warning, just a heads up.
Oh, seriously? Oh my gosh.
Yeah.
Okay. So Rapid SOS, it's a new service, and we will have the information. I'll put in the chat information for how to access. We have a regional mobile crisis effort. We have like quadrupled that service, and it's now lifespan 24/7. So that's also new. We have a similar service for our individuals with developmental disabilities. I will provide all the information, contact information in the chat. Also, collaboratively as a region, we developed a new crisis receiving center in Chantilly. And it's, we have 2 of them, and one is just new, and it's developed by RI International, Recovery International, best practice crisis now model. This shows you the needs have really skyrocketed while our vacancy rates have gone up. Recently, we lost 50% of our behavioral health clinicians. And so we're really, really struggling to fill those slots. Some of the other things that we are working on are community care teams, often called mobile crisis teams. We received a notification of an earmark from Congressman Don Beyer, and it's actually a notice of opportunity. We have to complete a SAMHSA grant for that, but we are actively working on that. And then
Deborah,
my final
go ahead and give you a time check. Okay, go ahead.
Okay,
Go ahead.
the final thing is we've been working with the Virginia Hospital Center for 5 years. We have a certificate of public need to add 16 additional adult behavioral health beds. Yay! And they will be in place within 2 years. They'll be mostly private rooms for a total of 34 with a separate nice outdoor space and designed with stakeholders with lived experience. And we're working with them on reconfiguring the emergency room to accommodate appropriately individuals in behavioral health crises and their families. And they are working with us on an intensive outpatient program for behavioral health. And then I have more to say. We're developing a first episode psychosis program that's coming in July. We hired the staff and starting that program. And we just recently opened up a recovery center for medical withdrawal. And we have other things to talk about, but I will pause.
Thank you, Deborah.
I have a resource of crisis contact information, so I will put that in the chat, and I will send Hannah you the PowerPoint so others can access it.
Thank you very much. And so please check that chat for really important resources from Deborah. Thank you, Deborah. I'm going to go ahead and Commissioner Smith, how's it going on your side? Can we go ahead and kick it to you here?
Yes, I think so.
Wonderful.
Give it a whirl.
All right. Perfect. Looking great.
All right. Security settings on Apple. Who knew? All right. Well, hey, thank you once again. Sorry for the little delay, but it is really a pleasure to be with you. Thank you, Delegate Hope, for inviting me to this. I'm really happy to share all the things that we're trying to do. And I think it's important that everyone know it, as transparency helps everyone kind of get together and truly understand not only what the crisis is, but what we're going to do to help fix it. But I can tell you that first off, that the Governor Youngkin and the administration are committed to transforming the behavioral healthcare system. And this is a governor who is open to change and doing things differently, not business as usual. And I can tell you, he wants to hear big ideas, and in order to achieve better outcomes for Virginians. So with that, we'll just get to the hot topic, the actual state bed crisis, or as it's called. It's a staffing crisis, as everyone knows. I'll just draw your attention to the middle column, the current capacity. And what that means is the actual capacity of the hospital. So for example, Catawba Hospital, or more in your region, Northern Virginia Mental Health Institute, has a total capacity of 134, current capacity of 128. So what that means is essentially it's based on a ratio of nurse to patients. And what you'll see is in the state facilities, many times you have one nurse under current staffing conditions for 15 patients. Now, mind you, these are patients that are the most challenging, that have probably, after the CSBs have done bed searches throughout the state, that they have been taken to NV-MHI. So if you understand one nurse with 15 patients, it's a very difficult situation. So we want to make sure that they're safe, because what we don't want is a negative outcome for the patients, the other patients that are there, and or staff. But we know that we have to do a good job of addressing this workforce crisis. And since we started this in my first 100 days, we've been able to open 116 new beds. And as of last week, the Commonwealth Center for Child and Adolescent was able to increase their capacity to 24. It's incremental as we, continue to hire people. And as you all know, the workforce crunch isn't just in behavioral healthcare; it's actually a nationwide issue. So we're getting creative, and I'll go into that in a minute. But we have to change in the way we do business in the state of Virginia, essentially. So what we want to see is the TDO rates go down overall. We average about 23 to 25,000 TDOs throughout the state. That has not changed year over year, which tells us we need to do more in the community. And I can tell you, Arlington, and the things that your CSBs and your team is doing there, although it may not feel like it, I can tell you empirically that you have a really good system, and you have a good team there that are doing everything they can, and they have a lot of resources that they're putting to work. So jumping into the alternative custody and transportation, where legislation is probably going to pass, we're going to increase the funding for that. We all know that it's a terrible situation for police officers. We'd rather have them back out into the field interacting with our citizens versus sitting. As you can tell from the picture, it looks like a precinct. And I've personally witnessed this here in Richmond. And it's not a situation that we want our law enforcement officers in. It's not good for the patients. And so we have a couple of creative solutions, as you can read. We'll be presenting memorandums of understanding to work with the off-duty police officers as a pilot. But again, all of these things are Band-Aids, because what we truly want to do is, number one, open up our capacity to our state hospitals, but we also want to get these patients the care they need. And again, that's going to be embracing this community care model. And we need to do that at scale, as Arlington is really blazing the trail. But how we got through this alternative custody work group, it is impactful, because what we're going to be able to do is reduce the burden that's on the sheriffs and our chiefs of police. I don't have a terrible amount of time, so we'll just go into like what we're going to do. So after assuming the role, I realized very quickly we didn't have a strategic plan. The agency has not had one in some time. So without a North Star, as I called it, how do we know where we're going? How do our partners know where we're going? So 1, 2, and 3 are right there on your screen. They all intertwine at some level in the Venn diagram. So we're going into this to design it in a way that everyone, our stakeholders, can also come up with a plan that integrates, because as we all know, it's not DBHDS or Arlington CSB or the sheriffs. There's not a one person solution or one entity solution. It's going to take the entirety of the healthcare system. And so with that, we look at our workforce. Now, one of the things I like to stress is how our team is looking at this. And we're looking at it from a statewide approach. So it took a little time to get people to take off their me hat and put on, how do we attract more workers and or providers to the state of Virginia? As the governor said, he wants Virginia to be the best state in the union to live, work, and play. So with that, we are looking at our regulations, our licensing procedures. How can we make it easier, but still maintain quality for providers to get a license to open an outpatient clinic? As I'm sure some of you may know, if you're in the field, to open an outpatient clinic, our licensing process, this is something I can control, takes over 9 months. And large companies, I mean, they have the capital, they can open up clinics very quickly. So how can we make it our workforce, so social workers, easier for them to obtain a license? Even with the hours of supervision, how can we address the things that can increase our workforce and get them into the field and treating our citizens, our Virginians, as quickly as possible? And then we're looking at ways to retain and engage our employees. I want to make sure that once we get the people, we've seen a higher rate of people leaving within 1 year. So all of those things, we have objectives and key results. It'll be measurable, quantifiable, and actionable. The next thing that we're going to address is a continuum of care. And that's really going to work with our community services boards and, quite honestly, DMAS, DSS. We're going to right size this imbalanced system and focus on our community services. We want to go heavily on intervention and prevention. We rely very heavily on an inpatient setting, and my guidance is that's not a good place for people. And number one. Number two, the emergency rooms cannot be the be all end all for people. We need an appropriate place where people get treated quickly. And some of those things are the STEP Virginia program and also Project Bravo, which I'm sure you've heard a lot about.
Commissioner Revenue, Commissioner Smith, I'm so sorry. I'm going to give you a 1.5-minute warning.
Well, I mean, that actually, I just kind of ran through it all. It concludes the actual presentation. I do look forward to questions, and I can just wrap it up by saying there are a lot of details that are going to be in this plan going forward, and we want to engage with the community in a way that's not been done before, to integrate everyone and their thoughts in this plan. And as my CSB partners can tell you, we actually have a planning session that we're going to be going into. And our legislators, we want to make sure that they know what we're doing every step of the way. I'm making sure that the new Behavioral Health Care Commission is integrated, and sheriff, chiefs of police, private providers. Everyone has to be on board with how we move this and transform the system. So I am very, very aggressive, and I'm very hopeful. I told my team that we need to move like people are dying, and they are. And so that's the urgency in action. And I didn't volunteer for, and remember, I always remind people I volunteered for this. I didn't do that because I didn't think I couldn't do or move in a fast way in order to get to where I think we need to be. And so I really do thank you and look forward to the questions.
Wonderful. Commissioner Smith, thank you again for being here today. I know your work is all throughout the state and covering a lot of territories. And so we're just really grateful that you're willing to virtually be here with us in Arlington. So thank you again for being here tonight. I'm going to go ahead and pass it to Sheriff Arthur. Sheriff Arthur has been with the Sheriff's Office since 1986, but she's been our sheriff leading the department since 2000. She was not only the first female sheriff in Arlington County, but also the first female county sheriff in the Commonwealth of Virginia. I thought that was a good fun fact that I wanted to share with you there. She's responsible for the operation of the detention facility, the security of the courthouse, the transportation of inmates, service of all court-issued processes and criminal warrants, the Alcohol Safety Action Program, the administrative estates, and administrative support to all areas of the office. So she's going to be speaking to us about how the bed crisis has affected our local jail here in Arlington. So Beth, I will turn it over to you.
Thank you. Thank you very much, Hannah. Good evening, everybody, and thank you to the Committee of 100 for having this, given us this opportunity to talk about this issue. So, and in no disrespect to Commissioner Smith or to Deborah Warren, who we work with every single day, trying to deal with this issue, you know, when we're hearing about solutions and things that we're looking towards doing, these are things for the much of that, you know, are down the road. Some of them, you know, we're looking to try to help with the CIT sooner rather than later, but, you know, 2023, 24, 25, 26, you know, that's not helping the sheriff's office literally right now today deal with the crisis of the individuals that we are seeing every day being remanded to our custody. All the issues that Deborah Warren talked about that we're seeing in the community with individuals that are, you know, overdosing, with individuals that, you know, we've seen an increase in mental health issues, and the crisis is even worse because of the pandemic. All of those things are mirrored in the detention facility, just like the community. So for the Arlington County Sheriff's Office, since we're not primary law enforcement, we're not making most arrests in this community. Arlington Police, Falls Church Police, State Police, Metro Police, Airport Authority Police, federal DEA this past week was arresting people that were protesting. So Arlington, you know, we have multiple jurisdictions that are bringing individuals into the detention facility. And as that happens, any individual that's arrested and brought into the detention facility, we do that police booking process, if you will. So when an individual walks through our door, they're going to be questioned about there's a questionnaire that they go through at that initial intake. Part of that includes questions about their mental health, any drugs that they may be using, etc. If the individual, after going before the magistrate who makes the determination whether that person, you know, charges will, that the arresting officer's charges will be withheld, that person, if they're going to be released back to the community, if they're going to be booked into the detention facility. So if that individual or a bond is set for them and that person comes into our custody, literally there's a door that you walk through, and then through the booking process, and then after that they come into the detention facility. Again, another questionnaire is asked, and we screen these individuals for medical and mental health issues. If we identify mental health issues, we are blessed in Arlington that we have a robust DHS staff that work in our facility through the CSB and through Deborah Warren. She has phenomenal people that work for us every single day. And so they, you know, we will then notify them, and they will come down and they will, you know, take a look at people. Sometimes they do that on the booking side as well and interact with the magistrate on an individual situation. So those individuals, and then if they're going to be staying at the facility, they don't get bonded out, they're not released into somebody's custody, and they're going to stay in the jail. They then go through a medical process where they are again screened for medical issues. If they've been doing any drugs, if, you know, recently they've done drugs, if they will be detoxing while they're in the facility, you know, and again, additional mental health and medical issues that will be processed. If we identify somebody that is going to be detoxing, they're moved into our medical unit. They are monitored there, depending on what their circumstances are, depending on what they're detoxing on, will depend on what treatment they will be given, medical treatment that they will be giving, and then and or mentally, you know, assessed for their mental health. Sometimes they go into our crisis center, a crisis unit inside the jail. Sometimes they may go to our medical unit based on their circumstances. But just for the month of April, we had 10 individuals that were placed in a crisis cell. We have crisis cells in the mental health unit that we built in our facility almost 30 years ago when we were building the facility, because we could see this issue happening and coming, that we were dealing with more and more and more people with mental illness. We did 7 ECO TDOs. We have done competency hearings for 10 individuals this month. Arlington has more individuals through the court system that are sent to Western State than any jurisdiction in the Commonwealth of Virginia. And so we tend to have somewhere between 20 to 30 people that are down at Western State at any given time. We have 179 people out of 250 that are on psychotropic medications that are in the jail. We have this month or last month in April, 21 individuals that were withdrawing from some type of substance. Typically, we see anywhere from 5 to 7, 8 people that are in our medical unit detoxing every single day. We've administered Narcan as needed this last month, one time, the month before, I think 4 times. We have hospital transports that are medical hospital transports in addition to ECO TDOs. Last Thursday, I had 1 person that was actually in the hospital for medical issue, 2 others that went out to the emergency room to be seen at the hospital, which takes 5 deputies off of my shift. And just like the mental health and medical field, we too are seeing a difficult time in hiring individuals in the public safety community across the board. And many of these people are in jail for trespassing charges, for drunken public charges. They're arrested for petty larceny. And so, we're seeing a lot of individuals that are nuisance type of crimes in many respects, but because of their mental illness, because of their substance abuse problems, they're not cooperative with the police. And again, I'm not the one making the arrests. I'm just the one that gets to manage and deal with these individuals when they come into our facility. And so what we've seen in particular over the last 2 years is literally a crisis of the individuals that we're managing and dealing with every single day. And I don't get the choice to say, I can't take anybody else at the end because we're full, or my staffing is not adequate enough today to manage another person that's in mental health crisis. Again, DHS does a robust job for us, but they're only there Monday through Friday. We utilize emergency crisis process through DHS. And if we have somebody on the weekend or at night, and work through them in that process. And if they need to send somebody in, they will come in, but often we work through the process, over the telephone or through a virtual process. And so, we're the last people standing. And when we're, waiting on people at the hospital on any given day, I could have 2 or 3 people at the hospital. PD could have 2 or 3 people at the hospital. And, that's 6 officers out of commission between the sheriff's office and the police department. And so where we are is, we're just constantly, as my grandmother used to say, borrowing from Peter to pay Paul, we're juggling all the time, all day long. Staff are juggling to try to figure out where we can manage and keep a person in the jail, if that person can get a bed. Mentally, they're just not capable of even being able to appear in court sometimes because of their condition. And so, the crisis is real and we feel it every single day. And I think last year when the state closed down their hospitals, it exacerbated the issue across this Commonwealth, certainly in our area, and what we're dealing with every day. And so I hope that as we continue to work both as a community on how we can manage and deal with these issues, and on a statewide level, that we can come up with some solutions that can help us deal with what we're dealing with, in the jail, for people that just have no business being in jail for the crime that they've been arrested for, and for, based on the condition that they're in mentally and physically, often, in addition to having substance abuse issues and mental health issues. They also have medical issues that are seriously untreated for many, many years. And so with that, I will stop and turn it back over to Hannah.
Thank you very much. I'm gonna ask our panelists to go ahead and turn their cameras on, unmute themselves. We're gonna go ahead and get to the Q&A here. And I'm gonna kick off. We had a couple questions related to schools. I'm gonna go ahead and ask, and I apologize, sometimes I consolidate these when there's multiples, but I'm gonna use Reed Goldstein, who is our school board vice chair, had a question that I'm gonna ask. Can the panelists talk about the connection between their agency's work and Arlington Public Schools, specifically how youth are impacted by issues, programs, and solutions that we've seen in the presentations?
I would like to take that if I could.
Great.
Hi, Reed. So we work on a very regular basis with APS, and particularly the school counselors and social workers. We are working really closely with them. We met with them, I think, weekly during the pandemic to coordinate services, or every other week. We had established regular meetings because we wanted to connect on not just mental health, but all needs. You know, my agency has the health division as well as, you know, economic independence and benefits. And so we wanted to make sure that kids and families had food, for example, housing, eviction prevention, all of those needs, in addition to the behavioral health. We work together very closely around levels of care, what a young person needs, and when it's appropriate to make the referral to the CSB. We're also working on a lot of prevention things like mental health first aid, things like that.
Anything? I'll go ahead and move to the next question unless Commissioner Smith or Sheriff Arthur, you have anything to add?
Thankfully, I'm not managing juveniles. I'll leave that to Deborah.
Okay. Adam asked.
Sorry, I apologize.
please go
I
ahead.
did want to add, we started a couple of initiatives, and hopefully some of you are familiar with this. It's called the Safe and Sound Task Force, and it's really focusing on their children that are essentially, they don't have a place to go when they're in crisis, and many of them are in the Department of Social Services care. And so when they have these crises, they the ones that are in the emergency rooms that we all hear about or know about, which is a terrible situation, the governor and the secretary have put together a task force that with collaboration from all over the state. And they have been working vigorously. As a matter of fact, I think it was last weekend, forgive me if I got it wrong, but it's the first weekend that we did not have a child sitting in a waiting room of an emergency room. I think it might have been 2 weekends ago. So they are making marginal progress, but it's a really good example of how we're bringing everyone together to tackle something. And out of this, we're learning practices. One of the big things we've learned is, who'd have thought, but communication. Just the simple fact that people don't know when some of these children are sitting in land in some of these emergency rooms, and crisis managers need to know what DMAS knows or DSS. So just getting all those people together in itself has been, you would think that shouldn't be innovative, but that it's making progress. So, and then we've also worked with the Department, Secretary of Health, HHR, and Secretary of Education have created a separate task force to address the crisis in our universities, and that's expanded to K through 12. And so we're looking to build out better systems to better equip our teachers and our school institutions for these things. So lots of efforts, and we're definitely going after it pretty hard.
Great, thank you. I'm going to share with our audience. I know that we want to do justice to the Q&A portion, and I want to thank our panelists who have agreed to stay on for an extra 5 minutes. We had advertised the program till 8, but we're going to just extend just a little bit to make sure we get some Q&A in. So thank you to our panelists for being willing to do that. I know this is important. Joseph asks, how will Arlington limit the use of force when it comes to crisis scenarios involving officers? He references the CIT training. Will there be mandatory CIT training?
I could take that one. So yes, I believe that something like 70% of police patrol are CIT trained. We lost our CIT coordinator, workforce shortage. He was hired by the state to do Marcus Alert. So, so we've been looking for a CIT coordinator. We hired somebody and they quit after a month. So we're still looking. But once we find an individual to do that, we're going to be doing a full court press. And we don't just train police, we train sheriffs. We as Sheriff Arthur was saying, we work with police forces, MWAR. We work with a variety of Pentagon police. We work with a variety of law enforcement officers, and our EMS, our fire EMS folks want to be trained, as well as our emergency call center. So we have a lot of work to do, but we are hampered by the lack of an individual in that position right now. Oh, and the question is, would it be mandatory? Yes, absolutely mandatory for police anyway.
Right.
Thank you very much. To our audience member, I want to apologize in advance if I mispronounce your name with the last name Dan and Felser. I know how that goes. So Malachi asks, how are staff recruitment and retention issues impacting Arlington's response to this crisis? I know y'all referenced that, but would you be willing to expand on that at all?
I guess it'll be me again. So as I mentioned earlier, in the fall, we got down at one point to 50% emergency services staff. And we had 300 shifts, scheduled shifts that were unstaffed. And this cannot happen. This is a mandated service and it's our, top priority. So what we did about that, I went to the county board with Anita Friedman, the director of our agency, and the chief of police. And we asked for money for hiring and retention bonuses for our emergency services clinicians. And we went back to our agency. We have 760 employees. About half of them are CSB employees. And we asked for volunteers to cover shifts, and we gave them bonuses to cover shifts in addition to their salary. And we gave them shift differential. So if they worked the night shift, they would get more money than if they worked the evening shift, and so on. And that was effective. We covered all 300 shifts. We had everybody all were pre-screened. We had pre-screeners on duty at all times. It worked out. We had no more losses in our emergency services staff. And so the retention bonuses were actually effective. And we have hired, I believe we have almost all of the positions filled. The positions that are unfilled are new positions. We have subsequently lost 50% of our child behavioral health staff, and they are far and few between. But we have hiring and retention bonuses for them. And we recently advocated for successfully in the last county budget to get hiring and retention bonuses for all CSB staff. It's critical. It's an underpaid profession and a very difficult job. And we want to show that the county is showing they value these services.
Commissioner Smith, I know this affects you at the state level as well. Is there anything you want to add?
Regarding staffing?
Yeah, how staffing, recruitment, and retention issues are impacting the response to the crisis.
Sure. Yeah. Well, that's the first objective is our workforce. And again, as I mentioned, we're not just considering just the state hospitals and I want to make an impact so I can help the changes that we can make internally. Again, I'm meeting with my counterpart tomorrow morning, as a matter of fact, from the Department of Health Professionals to try to pave a way to help the state of Virginia to maybe, from what I understand, a few years ago, you were allowed to, and please, Deborah, correct me if I'm wrong, but you were able to use master's prepared social workers prior to licensure in a better way. And it actually it was a win-win. They were able to get their hours of supervision, but also provided a more robust workforce. And so that the rules changed a few years ago, and I don't recall, like maybe 3, 4, not sure, but I think now it would be a good time to revert back to that, to allow people who are trying to get their hours and learn the field, because that it contributes to burnout. When you've got a licensed therapist that's in, number one, they're by themselves many times and running all over the place doing these assessments in the middle of the nights and weekends, it doesn't stop when it's cold and raining. And now you add into the fact that and they're sitting across from people who are shattered, and they listen to those stories hour after hour.
Right.
It would wear on anyone. And so what we need to do is, again, make it to where they have teammates. Well, you get teammates by not requiring them to, wait a couple of years to get a license. So that's a little small thing that I think we can do internally, but it'll have great impacts. And I've been talking to a lot of the executive directors, and I know that they would definitely welcome this. So we'll see how the coffee date goes tomorrow.
I just want to give you an example for your meeting tomorrow, Commissioner. Somebody reached out to me today. He is a psychiatrist in residency. He's very interested in doing mobile crisis work. I need someone to do mobile crisis work, but he's not I don't have a position that says so I'm trying to deal with my compliance staff, and I'm trying to say, look, we have a guy, he has a skill. Right. He wants to do this work. I can't figure out how to use him. It's not right. We've got to fix this. Yeah,
we have a lot of regulations and for good reason. We want to make sure that the patients are represented, and especially human rights and all the other things. We want to make sure that the people that are providing the care are certified and have the skills they need and experience. But we need to balance that. And right now, I think we need to really look a little bit harder at, because there are other states where the requirements aren't as robust and still have quality. Psychiatrists, you bring up a good point. It's another thing we need to look at. Like, I learned that 67.8, let's call it 68% of psychiatrists don't take insurance. And then if you look at that from like a healthcare parity perspective, so who's getting served? It's people that have cash, right? Money, dollars. So there's a reason for that. We can't say, well, the psychiatrists are at fault. I mean, do you go to work to not get paid? Like, it's just the market or the way that the healthcare delivery in Virginia is set up. So, part of Project Bravo, the next phase is going to be to increase rates for Medicaid. Medicaid rates haven't been changed in a long, long time. So upwards of 20 years now. That'll be a big ask. That's going to be a big ask because that's taxpayer dollars. But I think we all can agree it's time that we, as Deborah mentioned, that we pay for what everyone knows is an important thing to our community. So we have lots of, like I said, there are lots of key results that are built into this plan that I hope to be sharing with everyone in the near future.
Great, thank you. Commissioner Smith, are there plans that people can keep an eye out on, any particular email lists, any particular social media channels they should be following? If there was a way for people to stay in the loop on that, where would they look?
Well, I think the Community Services Board's avenue, and I'm sure as soon as we do this, it's probably going to be hopefully in the news. I hope to have something big enough that everyone can get behind. But I'd be happy to share it. Obviously, Delegate Hope is on, and he's probably going to be the first to know as well. So he's going to be part of the process. So we'll make sure we get the word out.
Thank you. Adam asks, how many mental health treatment beds are available across all of Arlington right now? What's the breakdown?
I don't know specific I can say, well, across the state, I think we have upwards of 2,600, and forgive me, I'm not going to know the precise numbers on this. So it's 2,600. And then around about 1,500 of those are state hospital beds. I think that's roughly. And I don't know the actual breakdown. Northern Virginia, specifically Northern Virginia Mental Health Institute, has 134 beds proper. And then I'm not sure of the breakdown of the private hospitals that are in that region. Yeah, I mean, in that region. You have Innova, and the Deborah could probably go into more about that.
Well, specifically, I can tell you in Arlington, we have the Virginia Hospital Center, which has a behavioral health unit, and they are fabulous. They have a great manager, but they only have 18 beds. And so we've been working with the hospital, as I said earlier, for 5 years. There was an agreement with the county for a land swap, actually where the CSB used to be. And so in the exchange, the Community Services Board and other advocates in the community really pushed for more psych beds. And so we've worked that through, and we're looking forward to that coming online within 2 years. There are no beds for kids in Arlington. We rely pretty much on Dominion Hospital, Poplar Springs, and other more distant hospitals.
Thank you. I think we probably just have time for one more question. If we go through this one quickly, then I'll get another one in. But Timon asks, and it's right on track for Committee of 100. We're bringing things full circle. A couple of years ago at a Committee of 100 meeting, it was proposed pairing a mental health professional with some police officers to approach situations from a mental health perspective. Is this being done, or are there plans for this? If this is underway, how is it working out? I think you've touched on this throughout your presentation. I know this isn't completely new to what you, is there anything you want to add to what you've already said on this topic?
So in Arlington, we allocated a full-time clinician to co-respond with police, to actually be in a police car and ride along. We found that was not particularly effective because of the shortage of patrol officers. It wouldn't be a consistent individual, and I think that relationship is key. Going out as partners. That, and it felt like the volume of calls, they were going on the day shift, and the volume of calls is more evening. So it wasn't particularly effective. So what we've done instead is we've shifted a clinician to the emergency call center, and during the hours of like 1 to 9, and then that individual, where there's a higher volume of behavioral health calls, that individual then gets dispatched right from the emergency call center, either picked up by the police or meeting the police at a location. And that's a little bit more efficient use of resources. I just have to say the police are phenomenal partners with us, as well as the sheriffs. I mean, we really have a wonderful relationship. It's just a really challenging situation dealing with this.
Sheriff Arthur, is there anything you want to add there?
No, I would agree that, we have great partnerships in Arlington. Just the resources are limited right now, in particular with staffing issues that we all face, police, sheriff, mental health, behavioral health. Deborah has a great team in the jail, and they do a phenomenally good job for the people there, whether it's the ACT unit, mental health treatment, the mental health unit. We built 21 mental health beds for males and 8 female beds in the jail when we built the jail 30 years ago. And as I said, and so they've been embedded in our facility and providing services for a long time. But, the crisis is hitting us, all of us very hard right now without having the beds available to get people to. And the individuals, most importantly, the individuals who are out there suffering in crisis. So
I just want to add that I think an important piece of this work, and Commissioner, you touched on this, it's the pre-crisis, right? It's the getting there and intervening as early as possible, and doing as much diversion as possible. And to that end, again, with the support of the community and voice of advocates, we developed a behavioral health docket that's both pre-plea and post-plea. And we have a number of other diversion programs, and we're looking to strengthen that area because we feel like, there are folks out there who are hurting, and if we can get to them before they are in such an acute crisis that they're a danger to themselves or others, that's ideal, and that's going to lead to better outcomes, and that's what we care about.
And Deborah, we have at least 12 people in that program now, right? Isn't, and then we have the drug court also.
Yes, we
that's,
have the
I
drug
think,
court.
pretty-
We actually piloted the behavioral health docket. It's 1 year old. We piloted and said we'll take up to 10 because it's very intensive case management. It's a very structured program, requires a lot of staff time. And we're oversubscribed. And we're really looking at, do we need to add another, therapist or case manager to that team so that we could expand the number of individuals in that program? It's proven to be a real success. With the support of many partners, including the judge.
Yeah, it's a great program.
I'm going to go ahead and conclude us there. I know we could go much, much longer. I wish we could go another hour or two. I just want to say thank you so much to our panelists, Commissioner Smith, Deborah, Sheriff Arthur. Really grateful that you joined us tonight. We know y'all are really on the front lines of probably one of the biggest crises facing the entire country and our local community right now. I'm sure there could be lots of debate. That's certainly where I felt that this is one of the biggest crises we're all facing. So grateful to you for the work that you're doing. Grateful to you for being with us here tonight to make sure the community knows about what's going on and has the information to be able to be hopefully part of solutions in the community as well and be supporters to you in the work that you're doing. So I'll go ahead and close this out. A reminder, we have a program next month, June 22nd, Future of Historic Preservation. And again, that we are collecting applications for the Board of Directors for next year. Please share if you really enjoyed this program. It will be posted live on our website. It also is on our Facebook page and has been streaming live and can be shared. So encourage you to share this program with people who should hear about it. I'm sorry we went over, but thank you again. Really, really grateful to y'all and have a great night.
Thank you. It was an honor to be on this panel with the commissioner and the sheriff. Thank you.
Thank you.
Bye-bye.